I would like to start by having my colleagues introduce themselves. Dr. Wells, please.
Good morning, my name is Dr. Roxie Wells. I'm a family physician. I serve as president of Bladen County Hospital and Hoag Hospital. Both hospitals are a part of Valley Health. The system serves Cumberland, Hoag, Bladen, and Harnett with patient access points in Robinson and Sampson counties. The health system employs about 7,500 people, and my particular areas employ about 300 people each. I have concerns about the impact of our current proposal. I have concerns about the impact that it will have on the 4 million people who live in rural communities. I'm happy to take questions after the presentation.
I'm David Zaas, a pulmonary critical care physician by training, president of Duke Raleigh Hospital, and here representing Duke Health. Duke Health had the privilege last year of caring for over 43,000 of our state employees. Our concerns with the Treasurer's proposal are not only the over $60 million impact that it would have on Duke Health, but are clearly the importance of access and quality of care for all residents in North Carolina, and especially our state employees. We look forward to working with the legislature around alternative proposals to help redesign and actually improve quality of care and maintain access for these critical employees and residents of North Carolina.
Good morning. Thank you, Mr. Chairman. My name is Terry Akin. I'm the CEO for Cone Health. We're based in Greensboro, North Carolina. We serve primarily a 5-county area around Greensboro. We employ over 12,000 individuals. Last year had the privilege of serving around 20,000 enrollees in the state health plan. I'll be the first to agree with the Treasurer that we need to very thoughtfully and carefully undertake steps to make healthcare more affordable. However, I believe strongly that there's a right way to go about doing this and a wrong way. The right way to go about doing this is to actually partner with those who've committed their lives to making a profound difference in the lives of others. I'm here representing physicians, nurses, and many other caregivers who are passionate about this and deserve to be treated as partners and in a collaborative way rather than in an adversarial way that would seek to demonize and disrespect them. So I believe that there's a way for us to preserve the welfare of our citizens in collaboration with caregivers and achieve the right results rather than the wrong results. That's why I'm here today.
Thank you. As mentioned, I'm Dr. Mike Waldrum. I'm the CEO of Vidant Health. We serve 29 counties in eastern North Carolina and are one of the largest rural delivery organizations in the state. I am going to give my comments from the perspective of a physician, a healthcare professional, and as a citizen of the United States. We heard earlier about, sometimes people talk about what hat you're wearing, and I can't separate myself from the environment that I live in and the people that we serve, and I will give my comments with those perspectives and representing the healthcare providers of North Carolina. And I'm going to give some examples and talk about some things, but really they're stories that can be told anywhere in North Carolina. And we think these are very important issues that the Treasurer has highlighted. And as was just mentioned, we feel that there is a better path to solve these legacy issues that have been built up for over 30 years, or 40 years actually, as the Treasurer corrected me. I was I guess I didn't raise my right foot when I pushed it. Right before the holidays, I was in Ahoskie, North Carolina. We have town hall meetings, and I frequently go to our communities and meet with local community leaders and our caregivers. And I was talking about the issues we face in Ahoskie, which are significant and are emblematic of the issues that face rural America and rural North Carolina. And at the end of my presentation, a group of nurses came and presented this Christmas card to me. They are 5 nurses that work in our labor delivery unit in Ahoskie, North Carolina. And all 5 of them had their baby recently in that hospital. And they came to me and they described their concern about the dialogue and the disrespect that they felt for what they do every day. And they know that every day we struggle, like rural America, to provide access to all of the people that show up at our doors and need care. And they specifically know that in maternal medicine that a lot of rural providers have stopped providing care to rural patients for their OB services. And so they were very concerned about that, and they wanted to make sure that I understood it from their perspective. Because to them, it's about the future of their families that the picture represents. It's about actually the future of their communities. And they know that when the health care is jeopardized to mothers specifically, but to the communities, that the community suffers. And we talk a lot about that. And so it really was a discussion about the future of their communities. And I assured them in that conversation that we will do what we always do. That if cuts get promulgated, that we will work hard to maintain our mission to improve the health and well-being of Eastern North Carolina. We won't follow the math. The math, the largest cut, is to OB physicians through this proposal. And that we will have to figure it out, because you may not know this, that North Carolina, rural North Carolina, maternal mortality, maternal death, and infant death is one of the highest in the country and outpaces some third world countries because women have to drive so far to get care. And they know that, and it's real to them. So, similar to what I described to them, that we will work like we do every day to balance our issues and our mission and deal with the fact that we are the only person, I represent the only person that has the moral and federal obligation to care for all of the citizens that show up at our door, regardless of their ability to pay. And so we have to balance that issue. And that's a hard issue, especially in rural North Carolina. And as I mentioned to them, that we will work to deal with those realities, and we can't just look at one group, which this plan does. And similarly, we've committed to work with the state. I personally have said that we will want to work collaboratively and constructively to fix the problems that were outlined, the liabilities that were discussed, that need to be fixed. But you do not fix problems without collaboration, and you do not fix them with one step. 30-year liabilities do not get fixed overnight. So we've heard a little bit about reference-based pricing, and just want to highlight a few things. So first, reference-based pricing is put a price to a reference, in this case Medicare, but it's essentially the old model of how we get paid for healthcare. So we've all been in transition to what was described as population health or value-based payments and value-based healthcare, because we firmly understand that having escalation in costs that is not acceptable. And any of you that have been in the communities that I live in or travel to every day, you understand that there is no room at the top of the price curve in healthcare. And the average reduction from this plan is 15%. And some will get increases, some will get 0. And so if you know math, there are some they get more than the average. So where does that happen? That happens in communities where they have higher uninsured or a higher level of state employees. I will also say that this is unprecedented and historic proposal, never been done in this state before to this level or in the country. The impacts will be large. You can see them here. Costs will need to be shifted to small businesses and other businesses, or, and it could be a mix of these things, hospital consolidation and closure. We had a hospital last week in rural North Carolina that closed its doors. Decreased access to services, inability to recruit, and this disproportionately impacts rural communities, as I mentioned, that have higher uninsured populations and are struggling. As mentioned, this is modeled after Montana, who's the only state that has done this, and we are not Montana. They don't even describe themselves as rural, they describe themselves as frontier. They have 1 million people in the state, we have 10. They have 33,000 state health employee participants, beneficiaries. We have 700,000, over 700,000. If you do the math on that, they have 3.9% of their, 3.1% of their population is in their state health plan. As mentioned, we have a large state health plan. 7% of ours are members of the state health plan. To put the numbers in perspective, in our 29 counties in eastern North Carolina, we have 184,000 visits, state health plan participants that got care last year. Also, critical access hospitals, you'll see the majority of Montana critical access hospitals are critical access hospitals that get special payment from the state. And because of all of these issues, we have a higher at-risk hospital industry, primarily in rural North Carolina. So we've heard a little bit about value-based and fee-for-service, but the facts are the federal government, Medicare, Medicaid in the state, Blue Cross Blue Shield in the state of North Carolina, all realize that decreasing fee-for-service prices does not improve quality and actually does not improve the cost of health care long term. And it actually may make them worse. And so they are all, just like us, these health systems that are represented here today and the ones I represent, have been in movement and investing our money to transition to take care of our people, and we can demonstrate that we have cut costs and improved quality at the same time. This proposal is the opposite movement, and we need all of our payers in the state of North Carolina moving in concert, because when you're a doctor in a small community and you're playing by different rules and different regulations, it gets very confusing on how you take care of the people that are lined up at your door. The other concern that I just want to put out there before I stop is that we have two unprecedented historic activities facing the state of North Carolina that are hitting us at the same time. Recently, the state of North Carolina has had two monumental historic hurricanes in 3 years that impacted the eastern part of the state. These will devastate the whole state. We hope that the Medicaid transformation goes well, but if you follow the literature, this is going to be very disruptive to our doctors, our hospitals, and the Medicaid participants in the state, and can be very disruptive to providing health care. At the same time, this proposal, if it's allowed to go through, will happen at the same time. Another historic, unprecedented, never been done transformations at the same time. I think there's a better way to solve problems. So moving forward, the hospitals and physicians stand ready to partner with the state health plan and its employees to move to value, to help people have higher quality lives and lower costs. And lastly, I want to just thank all of the providers, doctors, nurses, and others, technicians, that despite the allegations of impropriety, wake up at 3 in the morning to take care of all the people of North Carolina. And these are two nurses that we flew from the Outer Banks down to Dublin when it was surrounded by water during the last historic storm. And I want to remind everyone that when there's fires in the west or hurricanes in the east or snowstorms, that these professionals show up every day to take care of people and put their hands on them and sometimes in them to have them have better lives. Thank you.
Thank you, Dr. Waldrum.